Welcome to Delivering Miracles, a podcast to teach women like you tips and strategies on how you can have a safer pregnancy so you can bring home a healthy baby. I'm your host and your high-risk pregnancy expert, Parijat. I can't wait to chat with you. Over the last several months, I've had so many friends and friends of friends contact me and tell me about their fertility struggles. And it makes sense because infertility and fertility challenges are actually way more common than we let ourselves believe because it's so hush-hush and so quiet and we don't really talk about it. So I love that they're reaching out and talking to me and asking for advice or venting, or at the very least, we're just having this conversation, right? So I always tell them, depending on what's going on, my usual recommendation is, hey, you've been trying for a little while. Why don't you go see a fertility specialist and just get your testing done and figure out what's going on so you know the lay of the land, you know what the problem is, and you know what you need to do to fix it. And usually the response I get back is, well, no, that's okay. It's not that bad. It's not that serious. I don't think it's that bad yet. I don't think that's necessary yet. And I get it. That whole world can be scary because you don't know what it entails, and it seems so much heavier than to believe that, hey, if we just keep trying for a couple more months, maybe everything will be okay. But the thing is, when it comes to fertility, time is your most precious commodity. Time is literally of the essence because time is something that is working against you and your partner when it comes to fertility. It's not something that gets better over time like we think of other health conditions, right? So if you're struggling with fertility challenges, this episode is about demystifying the fertility world and showing you just how accessible and amazing reproductive endocrinologists are, what they can do for you, and just showing you that by going to a fertility specialist, you can get so many more answers to your questions. Best case, they tell you, hey, everything's fine, just keep trying for a little while. Worst case, they figure out what's wrong and then they have a solution for you to help you, which really isn't that worst case at all, right? So I'm super excited about this episode because we have an amazing guest that I'm really excited to introduce you to. Dr. Daniel Potter is a highly sought-after reproductive endocrinologist and infertility specialist practicing in Newport Beach, California. Dr. Potter is dedicated to providing his patients with compassionate and personalized care, and his approach to IVF results in maximal pregnancy rates for each individual case. He has a large patient following internationally and has appeared in both 60 Minutes Australia and the Today Show Australia. You've also probably seen him on The Real Housewives of Orange County as Megan King Edmonds' doctor, as well as on Flipping Out as he helped both Jeff Lewis and Jenny Poulos on their fertility journey as well, just as a side note. Dr. Potter has been a strong advocate for reproductive freedom and equality, including compensated egg donation, compensated surrogacy, single parenting, and same-sex parenting. He serves as the medical director of HRC Fertility, the largest fertility practice in the Western United States, as well as the laboratory director for Natera Inc., a genetics testing company. Dr. Potter is the author or co-author of dozens of peer-reviewed scientific articles and serves as chairman of the medical advisory board for the American Fertility Association. Welcome, Dr. Potter. I'm so excited to have you on this episode of Delivering Miracles. Thank you for being here.
Well, thank you for having me. I'm really excited to be here and to reach out to your listeners.
Fantastic. So I have about 172 questions for you. So I'd love to just jump right in if that's okay with you.
Sure.
So let's start at the beginning. And for those of our listeners who are just starting on their fertility journey or just realizing that, oh gosh, this is not going as smoothly as we thought it would, tell us, what is a reproductive endocrinologist? What is it exactly that you do?
Well, a reproductive endocrinologist is a physician who, after completing medical school, first completes a residency in obstetrics and gynecology. And then, so that's medical school for 4 years, then um, OBGYN residency for 4 years. And then after that, there's what is now a 3 year fellowship in reproductive endocrinology and infertility. And so that's, an additional 3 years after specialty training and what we call subspecialty training, where you concentrate on learning about advanced reproductive techniques and also, spend a lot of time in the laboratory, doing research and understanding and working out all the science behind how this works.
So you have to really like school and you have to really like reproduction to be a reproductive endocrinologist.
Yeah, yeah. I mean, if it yeah, it's a long road, but it doesn't seem like that if this is what excites you. So this is what my passion is. So to me, it didn't feel like work. It was a pleasure.
Absolutely. And so, how do you help patients who come to you?
Well, what we do is we first would take a history from the patient and their partner, if they have one, and from that, I can usually determine what tests, what tests need to be done. And, the first part of the process is really just information gathering. And what it really comes down to is that, to make a baby, it's almost like a recipe, like you're making something in the kitchen. And the basic ingredients that you need to make a baby are sperm, eggs, and, a uterus that works, and basically fallopian tubes if you're going to be doing in vitro fertilization. So, um, so the fertility evaluation is really going to, at its most basic, be looking and assessing those things in both, sometimes a qualitative, point of view. Sometimes it's just kind of binary, like tubes open, yes or no. Um, so once I have that information, I then can present the patient with their treatment options and the probability for success with each of those options. And then they can make an informed decision about which option they wish to pursue.
Absolutely. So, basically, we're talking about you want to make sure that the basics are working, and then you give the patients options, and then you counsel them on what those options are, and those options aren't the same for everybody, right?
That's correct.
I
That's
think that's really important to know because I think a lot of people they think of reproductive endocrinologists and they think, oh gosh, that means IVF. And that's not necessarily the case for everybody.
It's not necessarily the case for everybody. I mean, there are many patients who are appropriate candidates for intrauterine insemination, or in some cases, just, timed intercourse. So, there's a spectrum of treatments that are available to patients. But I think the most important thing is, to tell your listeners is if they're worried about infertility, they should go see someone about it. And in terms of who do you see, because you could see a family doctor, you could see an OBGYN, you could see a reproductive endocrinologist. Um, Generally speaking, if you're less than, I mean, first of all, you should always see an OBGYN at least. I mean, the family doctor, they're wonderful, but they are going to just refer you to the OBGYN. So unless you have to for insurance reasons, go through them as a gatekeeper, you can save yourself some money and time by going straight to someone that can actually do the assessment and help you. So the question then is, do you see a fertility subspecialist like a reproductive endocrinologist like myself, or when is it appropriate to go to your OBGYN? And so I would say that patients that are less than 35 or 35 or less and have been trying to get pregnant for less than 2 years are appropriate candidates to go see the OBGYN, and they would be capable of doing a fertility workup. And, it's important for you to take charge of your own care. What they should be doing is they should be doing a semen analysis to make sure that there are sperm and that they're sufficient to cause a pregnancy without assistance, and they should be checking to see if your fallopian tubes are open. They should be, if the sperm are normal, that is. And then they should also be checking to see how the ovaries are functioning. And in some cases, they'll check to see whether the uterus is normal. And then they can prescribe treatment, which would usually consist of Clomid, which is a fertility pill that can help you ovulate if you're not already ovulating. And if you are ovulating, instead of one egg, you'll release two. Now, patients that have been trying to get pregnant for more than 2 years, or if there's some reason for you to suspect that the sperm are bad, or they are, there's some risk factor for blocked fallopian tubes, like you've had previous pelvic inflammatory disease or something like that. I mean, if you have one of those things, go straight to the reproductive endocrinologist. And I would also say that anybody that's more than 35 years of age and they're concerned about fertility should go directly to a reproductive endocrinologist, because time is really of the essence at that point, and you don't want to waste cycles doing things that are relatively inefficient.
That makes sense. So to make sure that we got all that, so if you're under 35 years of age, so that's you and your partner, or just
the female partner?
Okay. So if the female partner will be carrying the pregnancy is under 35, or you've been trying for less than 2 years, you're recommending it's okay to go to the OB and get monitored there, but you don't want to just be given Clomid and say, hey, try this and come back and see me in 6 months. You want them to make sure that they're doing the testing so that you know exactly what's going on. And that way, if you do need to see a reproductive endocrinologist sooner, they'll be able to make the referral. Otherwise, they'll give you the treatment options accordingly. And you'll have the information about what you're dealing with and why this is being difficult.
That's correct. Now, the only thing I would say is that it's not under 35 or trying less than 2 years, it's and trying less than 2 years.
Okay.
So if you're over 35, I feel that you should go directly to a fertility specialist.
Right. Okay. So if you're over 35, or if you have some kind of pre-existing medical condition that you know is going to affect your fertility, then just go straight and skip you save so much time, so much money, so much heartache. You can just go straight to the source and really start digging deep to figure out how to get pregnant as quickly as possible.
That's correct. And what you want to, I mean, there are always exceptions. I mean, if there are normal sperm and your tubes are open, the OBGYN can try Clomid, and I would say you certainly wouldn't want to try more than 3 or 4 cycles. I mean, if it's going to work, it will work during that period of time.
That's good to know. That's good to know, because it puts a little end date on how long you should be trying this before you start escalating again.
That's correct. And, but having that workup beforehand, what it avoids, and I will see this occasionally, unfortunately, is, you'll have patients that will have been on Clomid for 6 months sometimes. They're in their late 30s, and when they come to me, they haven't had a workup, and it turns out that the husband's sperm is so poor that pregnancy wasn't really a possibility, and that they've just been wasting their time.
Oh, heartbreaking to know they've spent so much time waiting and hoping.
It is. I mean, and so for patients, I mean, it's hard to kind of put it in perspective for them sometimes, but time is the most valuable thing that we have. It's more valuable than anything else. It's more valuable than money. You can't buy time. So you don't want to waste it. And every month or year that goes by that you are not a parent is 1 month or year less that you're going to get to spend with this child.
That really puts that into perspective. So let's go with that for a second, though. So on the one hand, we hear these messages that biological clock, you've got to get pregnant quickly, don't wait till you're over 35 or whatever. And on the other side, you see women in their late 40s or Janet Jackson at 50 getting pregnant. And it's a lot of mixed messages about really how serious is this about saving time. So What do you say to patients like that who are wondering is this really that big a deal?
It is. So I would say, I mean, it's not like there's a cliff at 35. Your fertility is starting to decline, to some degree when you're in your 20s.
I've read that, yes. And that comes
So,
as a huge shock, I think, to people who don't realize that.
yeah, I mean, it's, for the vast majority of human existence on Earth, I mean, we weren't really living very much beyond the mid 20s or 30s. And so we're just not set up reproductively to really accommodate that. So, um, there's a lot of aspects of reproduction that become less efficient as we get older, and the slope of decline starts to become much steeper at 35 and takes another downturn at about 38 and another downturn at about 40, 41. And then when you hit about 43, the trajectory is really almost like a nosedive.
Mm.
So there are several things that will happen as you age. I mean, first of all, if you're doing assisted reproduction, you're going to make fewer eggs typically,
Mhm.
as you age. But I think most importantly, and what we've discovered here recently as we have introduced pre-implantation genetic screening as a routine procedure in IVF, is that we've discovered that even young women in their 20s will have probably 40% of their embryos that we test are chromosomally abnormal.
That's a huge number.
Yeah. And so it, when you're in your early 30s, maybe it's 50%. And by the time you're 35, it's probably, probably 65, 66% are going to be chromosomally abnormal.
This is such an important point because I can speak from personal experience. I was an infertility patient and I was in my 20s when I did IVF. And I had no idea that many of our embryos would be chromosomally abnormal. You think you're in your 20s, it'll be okay. There's going to be so many and there's so many chances. But you see how expensive these treatments are. You see what the numbers are, and it's shocking when you weren't prepared for it. So I'm so glad that you said this to really put this in perspective on if you want to have a family, you really need to take your fertility seriously, even at a very early age.
Right. And so, that's that's something that women should take into consideration. And if they plan on putting childbearing off, and I see a lot of, my physician colleagues that, with medical school and residency, and then they're starting their practice, I mean, they are almost always in their 30s and sometimes even a little further along. Um, and so, preserving your fertility at some point when you're younger is something that women should consider if they know they want to delay childbearing. And
Yeah.
it's sort of a reproductive freedom issue. It's also a reproductive control issue. It's giving women control over their fertility because the aging process we cannot control. If someone comes up with a way to control that, I would, I would be very happy because the best fertility treatment I could have would be a time machine.
Oh man, wouldn't that be amazing? So you bring up another great point, which is something I wanted to ask you about. So there's this new hot topic that everybody's talking about now, which is egg freezing. And when I hear about it from my clients or from friends, they go, "That's crazy. I would never do that. That seems insane and so far out there, and I would never do that." And yet I have a friend who did just what you said. She has some medical issues. She's in her 20s and she wasn't ready to settle down yet, but she knew that she didn't want to risk not having children when she was ready. And so she was in her mid 20s and she froze her eggs. And her family thought she was nuts. But I think it's genius because now she can be in her 30s, mid 30s, late 30s. Whenever she settles down, she's going to have 20-year-old eggs that she can potentially get pregnant with. So, talk to us a little bit about egg freezing. What is it, and who should consider it, and when should you do it?
Well, egg freezing is a process where you undergo effectively the same medical ovarian stimulation process that people undergo when they're going through in vitro fertilization. The difference is that after we harvest the eggs, we just freeze them unfertilized rather than fertilized as embryos typically. And so, um, when we do this, I mean, the eggs are put in a state of basically suspended animation for, really at this point, we don't know what the outer limits are, but I mean, for at least a decade or if not two, or longer.
That's amazing. Wow. And like you said earlier, that it really gives you more freedom and more control over when you want to start having a family without some of these effects of aging that you were talking about earlier.
Yeah, and I mean, it's the thing about it is it's an insurance policy, and a lot of people. I mean, people have a hard time with insurance. I mean, because an insurance policy, if everybody froze their eggs in their 20s, there'd be a lot of people that did it, and only a few people that ended up needing it. So I think it's important for people to kind of assess their individual situation. One thing I would encourage people to do, and we have an active egg donor program called Donor Nexus. And so with that program, we have young women that come to us that want to be egg donors, and we will do ovarian reserve screening. So the ovarian reserve screening is part of the fertility workup where we do a series of tests to determine effectively how many eggs you have left. And that will tell us basically how many eggs we can expect you to produce during fertility treatment and kind of what the overall prognosis with treatment is going to be relative to your age.
That's
And so,
cool.
in testing these young women, it's not uncommon for us to have women that have abnormal ovarian reserve even in their early 20s. And
Hmm.
so, I have an employee who's very open about it who um, wanted to be a donor for us. And when we did her ovarian reserve testing, it was abnormal. And so that's somebody like so she froze eggs. She was like 23 at the time. So she froze eggs to preserve her fertility because there's a good chance that by the time she's 30, she might not have many eggs left the way things were looking for her. So one of the things I would encourage would be to have a basic fertility, not fertility evaluation, but ovarian reserve testing, which just consists of a couple of blood tests.
Yeah, it's really simple, and but you can get a lot of information from just a blood test.
Just a couple of blood tests. If you had to pay cash for it, it might be $200. Have it done at some point, maybe after you graduate from college or something. And if it looks normal, you don't need to really worry about checking it again for another 5 years or so.
Hmm.
Like I would say, if you had a normal test in your 20s, I mean, if it looks like if you're a normal fertile 20-year-old, you wouldn't really need to check it again until maybe you're 30.
Hmm.
But I think that being proactive about it and making sure that if you happen to be one of these people that have poor ovarian reserve and you can identify that early on, you can, you know, change, your life probably by having egg freezing.
Absolutely. It really opens up your options then when you know ahead of time. I think we have this idea that our age is connected to our reproductive age, and that's just not necessarily true. And it's a huge shock when we find out that, hey, I'm only in my mid 20s, I'm in my early 30s, I'm young, I'm healthy, and what do you mean I don't have any eggs left? What do you mean I don't have, what do you mean the chances of conceiving are so low? It's a huge shock. And so I love that you're hitting home how important it is to be proactive about this.
Yeah, I mean, it's really interesting. It's something that we had no idea about until we had the ability to do the pre-implantation genetic screening.
Yeah.
And so the pre-implantation genetic screening is a process where we create embryos with IVF. We can take a few cells from the embryo and then amplify the DNA, and then sequence that DNA and determine whether or not the embryo has the correct amount of chromosomes, basically.
Right. Because if it doesn't, it's not going to implant and it's not going to become a baby you can bring home.
Right, or it'll miscarry or
Right.
be some other abnormality. So um, when we started to do that and we saw this definite association with age, with increasing age, we saw increasing percentages of chromosomally abnormal embryos. I mean, it got me to sort of thinking, because when you have something that's prevalent in nature, it's not an accident. There's got to be there must have been some, evolutionary pressure on this system to cause this to be a thing. And so, what I theorize is that, young women, like, let's say 20,000 years ago, when we were living in our natural state, like most of our existence, we've been like hunter gatherers, wearing loincloths and living in caves or whatever. Maybe a year or two after reaching, sexual maturity, like, talking about like mid teens, basically,
Mm-hmm.
women would become pregnant, or they would start mating, and there is a survival advantage to not getting pregnant every time someone mates with you. And
Right.
so, even in young women, 40% of the time, 40% of their cycles, they're basically throwing up a decoy, and that helps them not always be pregnant. Because
Wow.
if you're pregnant all the time, you can't care for the children that you have.
Totally.
um, it's kind of the same reason, with nature, with lactation and breastfeeding. I mean, that suppresses ovulation because obviously, you know being pregnant and having a child that's so small you got to carry it isn't, you're not going to be able to escape predators or
It's
other
not safe. Yeah.
harmful humans. so
Right. Absolutely.
so anyway, but that process, whatever that process is that causes the percentage of the eggs to have an abnormal number of chromosomes, um, that process seems to get worse as you get older. And, like I said, I mean, I don't think the system was set up to anticipate people trying to get pregnant in their 40s, because, at 40 exactly, probably 1 in 6 or 1 in 7 of the embryos are going to be chromosomally normal. And when
Wow.
you get to 43, 44, it's probably more like 1 in 12.
Mm. Wow. That's a really staggering number to keep in mind and to really think about, especially if you are thinking of delaying starting a family for whatever reason that might be. Just a great reason to stop and think about egg freezing and if that's a good option for you. So you have more options when you are ready to start that family.
Yeah. And, something else that I think is important for your listeners to think about is, what are the things that they can do to try to just preserve or enhance their fertility just in their daily life? Like, what are some things that can be done? And,
Do you have some suggestions of maybe like a top two or three that you think would be really helpful?
I do. So I would say that, for women, the number one thing is do not smoke. Smoking causes this. So you're losing eggs continuously. You start off at birth with, perhaps 2 million eggs. And by the time you go through menopause, you have zero, effectively, maybe like, a dozen or two. And during your life, you're going to ovulate maybe 400 of those eggs. So most of them just die off on their own. And
Mm.
that process by which they're dying off is sped up by smoking. So women that smoke go through menopause earlier. Women that smoke will see their ovarian reserve testing deteriorate faster. And so that's a lifestyle habit that, when you're in your 20s and you think you're bulletproof, um, it's something that you should take into consideration. So that's a very big one. I would say that if you have listeners that are at the point in their life where they're trying to get pregnant or want to get pregnant, um, eating a relatively high protein, low carbohydrate diet with, plenty of healthy fats, like from nuts and avocado and things like that. That's a
Hmm.
good thing. Making sure that you get an adequate amount of sleep is important.
Absolutely.
Um, and then, caffeine and alcohol. I mean, I think that those are fine in moderation. Moderation would be one or two servings of either one of those,
Per day.
but no more per day.
Mhm.
Um, so, those are things that they can do. When couples are trying to get pregnant, what I would suggest they do is first of all, if a woman has irregular periods, so if they have periods that are all over the place, like sometimes it's 21 days, sometimes it's 35 days, they're not ovulating, or at least not ovulating on a regular basis. And they should not waste time and just go directly to their doctor. And don't wait 6 months, don't wait a year. I mean, it's not you're not ovulating. Go straight to somebody, and they can give you some medicine to ovulate. But if you're having regular menstrual cycles, what you want to do is buy the urine kits, the little over-the-counter ovulation predictors.
Hmm.
The simpler the better. I mean,
You can get them anywhere. Target, Walmart, really just dollar store even has them, I think.
yeah. I mean, some of them are really complicated and use saliva and all this other stuff. Just the simple pee on the stick one, the one that I recommend, it has a little happy face on it.
Yeah, I remember those.
Uh, so you start that around day 10 of your cycle, and do it on your second time you urinate in the morning. And you should get a negative test at first. You want to have a couple days of negative, obviously, and then you'll get a positive. And once you see that thing start turning positive, once you see that little happy face pop up, starting that day, you're going to have intercourse for 3 days in a row. And that's basically how you're going to optimize your fertility.
That's fantastic. And so that's a really great suggestion for those that are just starting out, that don't have any indication that there's any problem, but they just want to optimize their fertility and really want to make sure they get pregnant as quickly as possible.
That's correct.
Doing the ovulation predictor kits and then intercourse, you're saying for 3 days as soon as you see the positive test, um, is going to help tremendously. And then to remind those of you that are listening, if you are over 35 though, or you've been trying for more than 2 years, you really should go see a fertility specialist
Yeah.
quickly.
Now, a couple other things that can be done. I mean, obviously, taking a good multivitamin or prenatal vitamin is helpful. Um, Also, coenzyme Q10 has been
Mm-hmm.
shown to, have perhaps some effect on fertility. The other thing that has, there's good studies to show there has been a beneficial effect to correcting is vitamin D deficiency, which is really quite common. And
Yeah.
so, if you have low vitamin D, the pregnancy rates are going to be a little lower. So, perhaps having that checked, when you have your annual checkup, and then having appropriate replacement, and then perhaps maybe adding a little bit of vitamin D or vitamin D supplement to your daily routine, especially if you don't get a lot of sunlight or have another source of it.
Right. So these are some great tips. So just to recap for those of you that are listening, things that you can do naturally to improve fertility just at home without any additional medication, especially at the beginning. No smoking is a huge one. Eating a high protein, low carb diet with healthy fats like avocado, nuts, coconut, things like that. Adequate sleep. We talk about sleep a lot on this podcast, so you know how important that is. Limiting caffeine and alcohol intake, managing and checking your vitamin D levels to make sure you've got them in the normal range and addressing them if you don't. Coenzyme Q10 and a good multivitamin, which your doctor can certainly recommend a good one if you aren't sure yourself. Dr. Potter, fertility isn't just a professional issue for you or something that you could approach professionally. You know infertility from two different perspectives, as a specialist and as a patient. Can you share with us a little bit about your personal story of facing fertility challenges and how that's impacted your approach to how you treat patients now that you've been through it yourself?
Well, early in my training, while I was doing my fertility subspecialty training, um, you know, my wife and I decided to start a family, and it became apparent after trying for a while that we needed to do a fertility workup, and we found that she had blocked fallopian tubes, and so we were going to need to do in vitro fertilization. And I mean, at the time, I mean, I've been in practice for 18 years, so this is a while ago. At the time, IVF success rates were very poor. I mean, we're very fortunate now; they're very high. But at that time, even for a young woman, she was in her 20s. We're looking at a success rate of maybe 20% per trial.
Oh boy. And was it just as expensive as it is now too?
Yeah, it was. It was.
Wow.
It was crazy expensive. But it was one of those things where, um, to find out at that point that I had this problem, um, and contemplating the possibility that I would not be able to resolve this issue in my own life, and how would I, take joy in doing this if I can't conquer this problem,
Totally.
and so that was pretty stressful. But I think everybody has these tests in their life and their lives, and for me, what this did was it made me a better doctor. It made me, I think there was a reason for me to be tested in that way, and a reason for me to go through those emotions, and to get pregnant and have a miscarriage, and just all the different ups
Hmm.
and downs that people go through when they're trying to get pregnant. And I think that those things helped me. I mean, it was terrifying at the time, but having gotten through it has helped me become a more compassionate and physician, and has helped me kind of always look at things from the patient perspective.
Yeah. Yeah, because you know what happens when you go home and you are dealing with all these uncertainties and the anxiety. You've lived through it, so you know how hard it is when you're outside of that doctor's office.
Yeah, I would say that the biggest thing, if you haven't been through it, and so you've been through this, so you have some
Hmm.
idea what I'm talking about, but it kind of seems like your life is on hold when this is
It
an
really
issue that you're
does.
trying to resolve. It's like your life is on hold, and we'll get back to normal life after we get this issue resolved, but in the meantime, it's really the focus of your existence, and it
Yeah.
becomes exhausting. It puts a lot of strain on relationships.
Yep.
And I always try to work with my patients and make sure that they are working together on this, and realizing that these are issues that are coming from outside, and that will hopefully push them closer together rather than further apart.
Absolutely. And for those of you that are listening, if you're finding that it's becoming stressful on your relationship, there's plenty of resources and professional support available to guide you while you're on your infertility journey. So you're not feeling like you're having to figure all of it out on your own. There is support available. So if you are at the point in your life where you're thinking about starting a family, or you have already started trying and it's not going as easily as you had hoped, I hope you've seen now how important it is to really listen to your body, look at what is going on, and to reach out for support from your OBGYN or your fertility specialist as soon as you realize that you need it, so that you can get all the information you need to make really informed decisions that are in line with your values, so you can build your family as quickly as possible. Dr. Potter, as to close this out, what are your final words of hope for couples who are listening and who are struggling with fertility challenges?
Well, what I'd like to convey to your listeners is that if they are committed to being parents, that there is always a way. It's not really a matter of whether it's going to happen, it's just how it's going to happen.
Oh, I
So,
love that. I love that. That's one of the most hopeful messages that you can hear when you're going through this and it's just feeling like doors are getting slammed in your face over and over and over. So thank you so much for that. Where can people find you if they want to reach out to you or maybe do a phone consultation or something and they're outside of Southern California?
Well, they can email me. My email is POTTER, I like Ivan, V like Victor, F like Frank. So Potter IVF at havingbabies.com, which is all one word. And
PotterIVF at havingbabies.com. Great.
yeah, and my website is havingbabies.com.
Fantastic. Thank you so much for being here and sharing just such a wealth of information for all of our listeners. And I just so appreciate you sharing your time and your expertise. Thank you so much.
Well, thank you very much for having me.
Wow. I am blown away by the amount of information and advice that Dr. Potter just gave us. I really wish that I could have gone on longer. And if you would like to have him back for more information, maybe we can even do like a Q&A. If you want to send in your questions, I can try to schedule him to come back if you have fertility questions. But what really struck me was his emphasis on being proactive. This is something that we take so for granted. I know I wasn't thinking about my fertility in my early or mid-20s. I just happened to be married in my mid-20s, and so that's why it came up. But you just think you have time. You assume you have time, and maybe you do, but do you want to risk it? Do you want to jinx it? Do you want to play that game when you could be proactive and really enhance your options and really increase your chances of having children when you're ready? And I love that we have so many options with that, from all these natural ways of preserving and improving fertility. We didn't get to talk about stress management, but we're going to have a whole other segment about that coming up. So that's from there to sleep, to lifestyle changes, to vitamins and supplements, to egg freezing. I mean, we've got choices. And it's so important that we think about them and talk about them really early so we can keep those choices. Because there's nothing more heartbreaking than desperately wanting a child and for whatever reason just not being able to do it. And if there's anything that we can do ahead of time to lower the chances of that happening, gosh, that would be incredible. If you are in the process of starting your family, if you're trying to get pregnant, if you are struggling to get pregnant, I hope now you've seen how easy it is to get information and how important it is to see a fertility specialist or your OB, like he said, if you think that that's helpful and you haven't been trying for very long, or if you're under the age of 35. But take the time to get all the information so you can make informed decisions about how to build your family as quickly as possible. You deserve it. Thank you so much for joining me here today. If you want to know more about how to make lifestyle changes to improve your fertility or to maintain a healthy pregnancy after infertility, I would love to chat with you, so schedule a consultation. You can do that on my website at parijatdeshpande.com. Also, I would love to stay in touch, so follow me on Twitter or Instagram. My handles for both are Parijat Desh. That's PARIJATDESH. The last thing that you need is additional stress and worry and confusion on top of struggling to get pregnant. So take the time to see a specialist, whether it's your OB or a reproductive endocrinologist, and get all the information that you need so you can take charge of your family building journey. Take it one day, one step at a time. You can do this.